scope straight, loads of movement. So work in straight lines. Really, it's a big mistake that lots of junior trainees do, is hold it like that, okay? Remember irrigation, remember suction, remember the, Praveen will get this joke because this is David Bowie and Freddie Mercury, under pressure, yeah? So the kidney is under pressure, okay? The youngsters won't know what I'm talking about, okay? But remember, you need some pressure because you need to see. Okay, we use gravity. Some people use these syringe or foot pumps. I think they're really dangerous actually, so if you can avoid them, usually gravity is more than enough. And we've got this tiny little thing that's like a
Pillow.
we call it a squisher, pillow, and that's a tiny volume and quite safe, okay? So, but you know, some of the new scopes have got pressure monitoring, really important to remember because pressure is probably directly related to post-op sepsis, okay? And then stone treatment. So lower pulse stones, honestly, if you can relocate them and thank me later because it will save you so much hassle, it'll save your scopes from being lasered, and it is just an easy thing to do. Sometimes you can't, but if you can, relocate it. Decide whether you're going to dust your stone or bust it and remove the fragments. Sometimes you won't have a choice, stones will do what they want to do. Okay, so most endourologists are what we call dust mentors, which we dust them when we can and we fragment them when they want to fragment. And then have a think about how you're going to get the stones out, basket, suction sheath. We've moved to suction sheaths recently. I'm a massive fan actually. They are brilliant and have revolutionized our stone-free rates after ureteroscopy. And then this is the worst slide in endourology, courtesy of my friend Olivier. This is ureteric injuries, okay? So this is why you look at the ureter when you're coming out, okay? Grade 1, I think we see that a lot. Very easy to do. You know, guide wire can lift a flap. The scope can lift a flap. Not a big problem. I sometimes won't stent that. Actually, that's fine. Grade 2, a little bit more scary. The wall is stretched and you can see the fibers. Always stent that. Grade 3, big hole. There's some fat. Okay, I've twice seen that, and on one occasion saw the descending colon. Okay, and that was unbelievable in that the access sheath went in really easily, no fuss. Did the stone, was coming out, and hey presto, there was a colon. Thankfully, because I always have a guide wire, and if anyone tells you not to do a ureteroscopy with a guide wire, please ignore them.